what is facial synkinesis and how do you treat it? Facial synkinesis is abnormal or aberrant movement. It is unwanted spasmodic movement which typically results from prolonged nerve damage. In the case of patients with facial paralysis from Bell's palsy or Ramsay-Hunt syndrome or other causes, if they do not have recovery within several months, we typically notice that they may have side effects of this synkinesis. And what we found is that this will lead to tightness, discomfort in the face, a constant feeling of tone or movement or pulling in different aspects of the face that are uncontrolled. Some of the more common forms of synkinesis include oral ocular synkinesis, in which when you move your mouth, your eye will shut, or vice versa, such as when you're blinking or raising your eyebrow, the corner of your mouth on that side will also pull up. We also notice that patients feel tightness or constant tone or pulling in their midface, along their cheek, and in their neck. Some patients may also develop dimpling in their chin on the affected side. Now, how do you treat synkinesis? Well, the first recommendation is typically some form of physical therapy. This can be done with a physical therapist, an occupational therapist, or a speech therapist, but should be done by someone who is trained specifically in managing facial paralysis. After that, our options include chemodenervation with a medication called Botulinum Toxin, otherwise known as Botox. This comes in several different forms or trade names, but essentially the purpose of using the botulinum toxin is to turn off the muscles that are acting abnormally. Now, this is not a permanent fix, and it does wear off after 2 to 3 months of time, depending on the location and the amount that was treated. But it can help to reduce the side effects of the synkinesis and improve symmetry and reduce the tension and spasming of the face. In rare cases, we can use surgery to correct severe forms of synkinesis. A procedure called selective neurolysis may be performed in some cases, and that can be done to lyse or cut specific nerve branches of the facial nerve that are acting incorrectly. Again, that procedure should only be done by an expert trained in managing facial paralysis. One final question that we always get is, does insurance cover these? And so it depends on the insurance provider, but typically physical therapy, botulinum toxin therapy, and in some cases surgery can be covered by insurance. So it's always worth asking your provider to request authorization so that you don't have to pay out-of-pocket expenses.